Thanks for staying with us right here on Sunrise as we continue this morning on our health segment. We're talking about blood clots. Research shows that it may be triggered by an injury, or it can sometimes occur inside blood vessels that don't have an obvious injury. Once these clots form, they can travel to other parts of your body, causing harm. Dr. Marlon McKay is here to elaborate more on these diseases and answer more of any health-related questions that you might have. So feel free to be part of our conversation by calling us on 011-447-1742 or 011-447-1620. Doc, good morning and thanks for joining us. So now, I've heard a lot of these conversations about, no, you know, there was a blood clot that this person had. I didn't actually know that isn't an actual disease on its own?
Yeah. So the medical term is deep vein thrombosis, or DVT.
DVT.
Yeah.
Okay.
And so what happens in our calf, you know, veins take blood away from the heart, arteries take it away from the heart, veins bring it back. And for any reason where blood sticks around or hangs around in the deep venous system of the calf, the blood can thicken and then cause a clot. And this can be caused, as you mentioned, sometimes by an injury, by certain illnesses, all right, and then not being active, smoking, obesity, certain cancers, certain medications, the oral contraceptive pill, for instance, hormonal replacement therapy. So any condition that is conducive to poor circulation. And so the blood thickens and then can form a clot in that deep venous system, which in itself is a problem. But more serious is that clot moving or breaking off, mobilizing, and then traveling up the veins toward the heart, lodging into one of the arteries in the lungs. And now it's called a pulmonary embolus. So a clot that's moved shuts off the blood supply to one of the arteries in the lungs, and that can be fatal. And that's when you hear sudden people who died suddenly, just collapsed as a result of this clot that moved up toward the lungs.
So, so in terms of like detecting that, obviously it's something that can take a while.
Yes, so it happens over a few days. The moving can happen very quickly, but the leading up to the actual clot forming in the leg or in the calf, that can take a while. But people those who need to be very, very aware of it is people who travel, for instance, long distance flights, long haul flights, and who sleep on the plane, who don't move around. People who are overweight, people who are smokers, on the pill. So, and then it can manifest as a pain in the calf. Pain, tenderness, swelling, redness, it feels warm. So if you know that your calf, your leg is sore, but you did not hurt it, you've never bumped it and it feels like a muscle pain or something, you need to get to a doctor, because that could be the start or the formation of a clot. Okay,
what are some of the warning signs? I guess you touched on that, a little bit of that. So if there's swelling and then there's pain, but you know that you didn't hurt yourself. Okay, so in terms of it dissolving, what is the process and how does
it? So once you have these symptoms of suggestive of a clot and you think that you know, you may be getting a clot, you then go to the doctor. The doctor needs to confirm it. All right, and so we examine it and we look for those signs, and then we do there's a blood test that one can do, and then there's a special X-ray, a sonar called a Doppler sonar that we can do of the leg, which will identify that there is a clot. Once we've identified that there is a clot, it's a matter of urgency that that clot needs to be dissolved. We need to make sure that you can break that clot up and prevent it from embolizing or jumping and moving up to the lungs. And so we put you on medication called blood thinners.
Okay.
Blood thinning agents or anti-clotting agents that can then allow that clot to dissolve. Okay,
did we touch on what actually causes it to clot in the first place?
Okay, so certain conditions can be conducive. All right, there's certain patients, people who in populations may have a genetic problem. Okay. They lack a enzyme that helps the blood or prevents clotting. Okay. So there's a deficiency of one in the blood clotting process. But most of the things that can lead up to or can cause it are due to certain conditions, as I mentioned, being overweight and not smoking. You know, there's a study that was launched over the weekend that spoke about binge watching TV.
Yeah.
So people who decide, I've got a weekend off, I'm going to just download the whole series of my favorite program and sit on the couch and watch the whole weekend. Increased risk of a clot. You need to, at least between episodes, get up. So anytime that you're sitting for a long time and not moving, you're putting yourself at risk of a clot. Certain medications, your doctor will inform you. Smoking, lack of exercise, and then, as I said, flying is always an important factor.
Effect on that. Okay, so is there to be preventative, because prevention is always better than cure, what are some of the things that I can do? Obviously, exercise is important. The thinning part, just to make sure that, you know, my blood is...
Yeah.
Can I eat my way out of this?
So we need to be careful. We're not saying that everybody will get a clot.
Yeah.
And the risk is there.
Yeah.
But there are certain basic things. So if you know that you're going to be flying, make sure that you move.
Okay.
Okay, every hour get up. And you'll see in the pamphlets, they tell you how to move your ankles and exercise your calf muscles. If you're a smoker, you're at risk. If you're overweight, you're at risk. If you're not exercising, you're at risk. If you're on certain medications, then the doctor must inform you, especially ladies on the pill. Pregnancy is a very high risk factor. Post-op is a risk factor. So if you've had an operation, don't lay in bed. Get up out of bed, move around, mobilize out of bed as soon as possible.
Okay, the prevention pills that you mentioned, why is it a cause for clots there? Yeah,
so there's the chemical within there, the part of the estrogen and the makeup of the pill is inherently can result in that. Now again, we are not saying that every pill is dangerous and every woman who is on the pill will get a clot, but it's something to keep in mind, and that your prescribing doctor, your GP or the gynae, needs to evaluate you properly and identify if you are at risk and inform you, counsel you about the risks of being on certain pills that can cause or can lead to clots.
Okay, so the diet thing, you said it's not other things.
There's nothing specific in the diet. It's it's all around healthy eating that can prevent obesity, for instance, and then healthy eating together with regular exercise.
Can it happen in children?
It can happen in children, much more. It's rare in children unless they have a clotting factor deficiency, a blood abnormality, or some of these inherited things. But generally, kids are very active, and there's very few risk factors. Obviously, with an operation, if they're laying still for a long time, that can put them at risk, but it's much more rare in
Okay,
kids.
lastly, what's the difference between blood clots and menstrual blood clots? Same thing?
No.
Okay.
So menstrual blood clots is bleeding with clots.
Okay.
Whereas blood clots, these are in the veins where the blood is standing still, not flowing nicely, and the clot forms, which then blocks the vein.
All right.
Poor flow, and then that clot can then move up to the heart.
Well, Dr. Melon McKay, as usual, thank you so much for coming through.
Thank you so much.
And enlightening us. That was Dr. Melon McKay chatting to us about blood clots this morning. Do stay with us. So much more still to come right here on the show.